Back on location in West Ashley with Coastal Vascular and Vein Center, along with Dr. Edward Morrison, board certified, and along with his patient, Cynthia Dale. And in our first segment, we talked about Cynthia having varicose veins, hurting at the hip, and coming in to see you. What sort of treatment did she undergo?
Well, what we do first is obviously examine the patient, and based on the distribution, where physically the veins are located, we're making a decision where the valves are busted and where we need to focus. Ms. Dale had a unique event and a unique series of findings, not only superficial varicosities right under the skin, but also symptomatology of being very full of what we call pelvic congestion syndrome. And it's a real entity where women hurt and ache because the same blood that's going in reverse in the lower leg is doing it in the pelvis. And so we're able, with ultrasound, which we do, we've got 5 technologists here doing ultrasound routinely, is look at the veins, find out where the valves are busted, make some decisions how we help these patients.
And Cynthia, we talked in our first segment, you're in a lot of pain at times.
Yes, sir. I mean, it was awful. At night, I could not even sleep on this side, and that's the side that I like to sleep on. It would just ache and cramp and throb on that side.
We're going to go back to the doctor now and see exactly what he did and then also how you feel today. Doctor, what sort of procedures did you do on Cynthia?
Well, Cynthia had to have 2 things done. The first was, it sounds complex, and I'm going to put this up. But remember, blood is never supposed to run in reverse. And this depicts your arteries, but I'll show you, we'll take a second to understand that our pelvic blood goes up almost to our kidney veins and back to the heart. Okay? These are the veins, typically on the left side in females, that become varicose. These gonadal veins are supposed to be less than this big around, and in some women, they'll be literally this big around. And when you inject contrast in it, blood goes shooting down in the pelvis with massive varicosities here. So what we did, actually right on this table, under local anesthesia, with a little bit of sedation, with, again, a minimally invasive technique, inject, put a device in here to shut that up so blood is no longer going in reverse. Takes about 10 minutes, and you're in and out of here quickly. Once that's done, then you take care of the superficial skin veins in the leg with what we call venous closure or venifit procedure, which again is done here under local anesthesia. No incisions. You're able to access a vein with ultrasound, put a device in that utilizes radio frequency energy to shut the vein down so blood's not going in reverse, and you walk out.
You walk out. That's fantastic. How was your overall experience here?
It was great. Both procedures were very comfortable. I had a little bit of sedation beforehand, so I was pretty relaxed. Both of them took about maybe 20 to 30 minutes apiece. Hardly any pain at all. Just a little bee sting with some local numbing, but that was really about it.
And you're able to sleep on that left side now?
Yes, sir. I can.
That's huge. And you wear shorts often now?
I can wear shorts and dresses and not have to worry about those ugly veins. So, yes.
Fantastic. Doctor, tell us about this seminar that you have coming up, this talk that you have coming up.
We have done screens and screening throughout the Tri-County region. We've got multiple outpatient office locations, and we've got one coming up soon. I can't remember the date,
September 24th.
September 24th.
4 to 7.
And what we actually do is see patients between our physicians, assistants, and doctors, and our vascular technologists. Look at them very quickly, look at their legs. If you see large vessels that are these veins refluxing, we tell them they've probably got the disorder and they ought to be seen formally. But we'll see 40 to 60 patients through these events, and they've been a good service to the public.
Doctor, thank you so very much. Cynthia, thank you so very much. Coastal Vascular and Vein Center, not only in West Ashley, but also in North Charleston. Check us out on abcnews4.com.